Respected faculties, my seniors, my colleagues, and the juniors, I am presenting a report of two cases on replacement of missing single anterior teeth with resin bonded fixed dental prosthesis. Background and the introduction. There are various options available for replacement of missing anterior teeth. This includes removable partial denture, fixed dental prosthesis, and the dental implants. In the aesthetic region, minimally invasive fixed restorative option for replacement of single missing tooth is the resin bonded bridges. Mainland bridges are the resin bonded bridges for which there is no need for extensive teeth preparation and also excludes surgical risks associated with implant, so patient more easily accepts this treatment modality. Mainland bridge can be constructed with different materials, and those materials includes metal ceramic, polyethylene fiber reinforced composite with porcelain veneers, all ceramic material, zirconia with porcelain coated on the bonding aspect of the wings, and the zirconia with porcelain veneers, and the porcelain veneer is coated on the facial or the labial surface of the zirconia framework for enhancement of the aesthetic. In this report, restoration of missing lower anterior teeth with mainland bridge of the metal ceramic and the zirconia is presented. Now, starting with case report, case 1. A female patient of age 51 years presented at our department with complaint of missing lower anterior teeth since few days, and the patient has the history of mobility of the same tooth since 20 years, and 7 years back the tooth became more mobile, so she got extracted that tooth, and the same tooth was modified and they used as pontic and was bonded to the two adjacent abutment teeth, and this natural tooth pontic became discolored and the dislodged, and she came for the replacement of the teeth with the permanent means. On examination, mandibular right central incisor was missing, and there was recession of the adjacent teeth and the mild grade of the periodontitis. Treatment options, different treatment option includes removable partial denture, fixed dental prosthesis, conventional and resin bonded, and implant supported crown. And patient disagrees for the removable partial denture because of difficulty in maintenance and the wearing. And during implant treatment planning on CVCT, there was inadequate bone for the implant placement, so now best options available for the patient is fixed dental prosthesis, which is conventional and the resin bonded one. And with the discussion with patients, she agrees to have resin bonded bridge, mainland bridge with zirconia. Clinical procedure includes primary impression was made with irreversible hydrocolloids. Diagnostic cast was poured with the dental stone. Cast were articulated and the occlusion, overjet and overbite were evaluated. There was adequate clearance between upper and the lower incisors. There was no abnormal or occlusion or unbalanced occlusion, and there was no contact between the upper and the lower teeth, and there is no any sign of the parafunctional habits, and the minimal preparation of the 0.5 millimeter done within the thickness of the enamel on the lingual aspect of the 4-2 and 3 on as shown in the pictures. Polyvinyl siloxane impression made, and the cast was sent to the laboratory. In laboratory, cast was scanned and the milling of zirconia bridge was done. Particle abrasion of the bonding aspect of the zirconia wing done with the 40 micrometer of the alumina, and as the bridge was delivered, fitting was checked, adjusted, and was bonded with resin bonding cement. post-restoration instruction was given, and the recall and the follow-up was maintained regularly. And in case of the case 2, 49 years female patient reported a Department of Prosthodontics BPKIHS Dharan for replacement of missing lower anterior teeth. On examination, there was missing 3-1. Patient has also similar history of extraction of the tooth 2 to 3 years back, and she has also the same natural teeth as Pontic bonded with the composite resin. Diagnostic impression was made with the irreversible hydrocolloids. Diagnostic cast for and the treatment planning done. Again, in the CVCT, there was inadequate bone for implant placement. All feasible treatment options were given to the patient except implant. Patient preferred to have metal ceramic Maryland bridge as it was more conservative and cost effective. Conservative tooth preparation done on the lingual aspect of the 3, 2 and 4 1, and polyvinyl siloxane impression was made with putty and light body. Cast was poured, wax off was done for framework investment, and the casting were completed. Ceramic was added on the pontic and the firing was done. Sandblasting done on the inner aspect or bonding aspect of the wings. Once the bridge were fabricated, fitting was checked and the necessary adjustment was done. Bonding of the bridge was done with the resin bonding cement, and also the regular follow-up and the regular examination was maintained, and in 1 year's follow-up in the both the cases there was no complaint and patient was satisfied. Discussion. The main disadvantage of resin bonded fixed dental prosthesis is conservation of tooth structure, which is one of the biological principle of fixed prosthodontics. In a study of 358 patients reveal higher satisfactory rate among the patients with resin bonded fixed dental prosthesis. Overall survival rate is 77% after the 10 years. Periodontal response in the abutment teeth was same as the unrestored contralateral teeth in 10 years follow-up study. Regular recall visit and the examination are necessary because of chances of caries development and plaque accumulation on the abutment teeth. Debonding may result by biting or chewing hard food, so patients should be warned about these dangers. Debonding can be successfully rebonded, but if repeated debonding occurs for more than twice, re-evaluation of preparation and construction of new prosthesis is to be considered, or it should be replaced with conventional prosthesis. Aesthetic is major problem with metal ceramic bridge due to display of metal wings, and also in case of the translucent adjacent abutment, the display of the metal causes the shadow or the hue from the abutment teeth, and which hampers the aesthetic of abutment tooth. Also, reinforced composite resin. Porcelain zirconia offers excellent aesthetic outcome. Uh, Problem with zirconia bridge is that it cannot be acid etched, so we should go for the particle abrasion of the wings for the proper bonding of the zirconia Maryland bridge. Careful patient selection along with proper treatment procedure, precise and the correct framework design, and the meticulous bonding technique ensures long-term survival of the treatment. Concluding my presentation, Maryland bridge is considered as less invasive option for treatment teeth replacement. It is affordable to the patient and also maintains aesthetic as well. And in the past, addition was common problem, but with evolution of the better bonding technique, that is dual care resin bonding cements, it has become more popular options. These are my references. Thank you very much.